Hello again, everyone. I'm Andre Sr. with KTVU Fox 2 in the San Francisco Bay Area, and we're continuing to follow the effects, the fallout, the issues that continue to arise as we deal with the COVID-19 pandemic that's affecting so much of the country, here in the Bay Area as well, where we've seen a resurgence of cases in the Bay Area. So we're joined now by Lori Bremner. She is the director of California Grassroots for the American Cancer Society Action Network. Thank you so much for joining us today.
Thank you, Andre.
All right, Lori, so your organization did an interesting study here, and I've heard about this, and I've been reading about this lately, and this is, it's kind of sad in my opinion, because you have people that have other issues such as cancer right now, and this pandemic is causing a big issue for them. You all conducted a survey, and it found that many people that have cancer are finding it difficult to get treatment, to talk to their doctors. Tell us a little bit about the study that you did and kind of what the results were.
Certainly. Thank you, Andre. We've actually surveyed cancer patients and survivors now twice since the pandemic began, so that we can really dig into what the effects of the pandemic are on their continuing cancer care. And the second survey found even more delays than the first in care, along with financial strain and negative mental health effects as well. What we find is, the pandemic has put a lot on hold, but one thing that hasn't stopped is cancer. And cancer patients are finding it increasingly challenging to get their necessary health care as the COVID-19 pandemic persists. Many are experiencing financial stress and mental health issues as they try to navigate this very difficult health and economic environment. And as a cancer survivor myself, I can tell you that having cancer at any time is scary, but having cancer during a pandemic is terrifying. So some of the details of the second survey, what we found is that nearly 90% of the respondents reported that the pandemic had affected their healthcare in some manner. And that 87% is up from only 51% a month ago. So the condition is worsening for cancer patients.
That is a big jump. I didn't mean to interrupt you, but that is a big jump in numbers. What does that say to you?
It says that the fatigue is setting in all different ways, that maybe they could put a few things off at the beginning, but as the pandemic persists, their healthcare needs go on. Their cancer treatment needs to continue, and their other healthcare needs, not just the cancer, but all the symptom management as well.
And I want to ask you this. 1 in 5 say they are worried their cancer could be growing or returning due to delays and interruptions caused by the COVID-19 outbreak. You said you're a cancer survivor. Could you imagine going through what you went through at this particular time?
No, and that's this finding in this survey that for me personally is the most troubling. That's the one that keeps me up at night, is thinking about people at home not knowing if their cancers come back or the tumor is growing. They're getting sicker and they can't access the care that they need. That is just terrifying.
So what is keeping them from accessing the care that they need at this moment? We know that these frontline medical workers are helping with the pandemic, but we know that cancer is still the #1 killer here in the United States. So does that not also set on equal ground and allow you access to go see your doctor at this time? What's going on?
It's a difficult challenge. And in this second survey, we also surveyed healthcare providers. And what we're finding is that they are doing their best to balance the needs of an immunocompromised population with the need, so they want to balance their safety with the need for timely cancer treatment. But unfortunately, the result of that balancing act is a delay in treatment for many cancer patients. So many of the appointments need to be done by telemedicine over Zoom, which is wonderful that they can do that. However, it doesn't necessarily in all cases replace a face-to-face appointment where you can feel this nodule, where you can actually look in their eyes and hear what they're experiencing at home.
You said immunocompromised. So a lot of folks who have battled cancer and overcome it, they are now more susceptible to other illnesses.
Right. Because of the treatment we've gone through, we are all acutely aware that we are at greater risk of contracting COVID-19 And we are also at greater risk of worse symptoms than the population that is not immunocompromised because of the after effects of treatment on our bodies.
And you also noted in the survey, and you mentioned just a moment ago, and I want to dive into that a little bit. Some of these folks that are dealing with cancer or concerned about their cancer returning, or they are worried about becoming ill because they've gone through the treatments that are very rigorous and tough on the body. They're having a tough time, it says here, getting in touch even with the provider to discuss this. We have telemedicine now. Why is this still a difficult thing for these folks to get in touch with their doctors, even through telemedicine?
Yeah, something we need to look into further, because as 1 in 4 of the respondents did note that they have a difficult time getting in touch with their providers to answer questions about their healthcare needs. And I mean, I think that the entire healthcare system is under such strain right now. The COVID-19 pandemic has really shown a light on the gaps in care that cancer patients have faced and known about for a long time. Cancer patients are very heavy users of the healthcare system. And so we find out where those gaps in care exist. And the COVID-19 pandemic has really demonstrated those in a major way.
Nearly a quarter, 23% in this survey say they worry they may lose their health insurance due to the pandemic and its effect on the economy. That is an absolutely worrisome thing to hear if you are someone dealing with cancer, and even if you don't have cancer anymore, you still have to go to the doctor to get your checkups.
Exactly.
That is a seemingly a concern thing to worry about. If my father had cancer, for him not to be able to access a doctor, when he was still around, would be very concerning to me. Is there anything that can be done to help people that are concerned? Again, we're talking about nearly a quarter of the folks that you surveyed that are worried about this. I mean, that shouldn't be a concern from someone dealing with cancer, I don't think.
Absolutely. And we're calling on Congress to help with that. We're asking for Congress to direct Health and Human Services to open up a special enrollment period for the Affordable Care Act, so people can get the care that they need without some other qualifying life event providing them that access to healthcare.gov. We're also worried about Medicaid, which in California is known as Medi-Cal. It's a really important safety net for cancer patients and survivors who can't afford private health insurance. And we're asking Congress to increase funding to the Medicaid program as well by 6%.
That it seems to be that will be the only way, apparently, to ensure that these cancer patients and cancer survivors get help. Is that what you're saying? Congress intervention here?
We need help from Congress on this, yes.
All right, so let's move on to this next study here, and this is equally as disturbing because I'm more shocked every time I read through this information. And when you have someone that's dealing with such a terrible disease, and then you're layering something else on top of it, another health issue, because 48% of patients say the COVID-19 pandemic has had a moderate or major effect on their mental health. Tell us a little bit more about that.
Right, well, when you have the financial stress going on, almost half said that the pandemic had impacted their financial situation in some way, their ability to pay for care. So there's the financial stress that a lot of people are facing. Add that to the idea that 1 in the 25% think they may be losing their insurance. And then just the basic fear about having cancer at any time, let alone now, with reduced access to their doctors. It's shocking, but it's not a surprise that almost half are having a moderate or major effect on their mental health.
You said before that why are they afraid that they're going to be losing their insurance? Is it because they're losing their jobs? Is that what's happening?
Either the patient themselves is losing their job, or their spouse through whom they're insured, or they can't afford to pay for their premiums if they have private health insurance.
And so you couple that with the issue of not being able to even get through to some doctors at this moment. I mean, you really have a recipe for disaster here. Does your organization know of any help that's coming down the pike to look after this vulnerable group right now?
Well, nonprofits ourselves are a major support for patients and survivors who are dealing with these issues. Of course, nonprofits are struggling as well right now because donations are down dramatically. We're also calling on Congress to help with that. The CARES Act provided some relief for smaller nonprofits, but it doesn't provide any assistance for larger nonprofits like the American Cancer Society. And we're hoping that the next stimulus package will do that. We're also asking Congress to strengthen the charitable tax deduction that was part of the CARES Act to encourage people to support the nonprofits that are out there helping patients during this challenging time.
That is definitely a major concern is these nonprofits. I know down in Santa Clara County, they launched an effort with businesses to help these nonprofits, mostly food banks, because they were very much in need. But people that are dealing with cancer or cancer survivors depend on organizations like yours as well. Now, I want to move on to this next point here, and it says 67% say they worry it will be harder for them to stay safe when social distancing and other restrictions are relaxed in their area. And we see each time those restrictions are relaxed, I now know here in the San Francisco Bay Area, I see more people out. I was just talking to a friend of mine down in San Mateo County who said he went to the beach in Half Moon Bay and, with his family, just them. And he said most people weren't wearing their masks. And keep in mind, they still are under restrictions in that area. So this has got to be a concern for you. You're probably hearing this from those folks who are seeking advice and help from the American Cancer Society as well.
Very much so, and it's actually a double whammy because you're more likely to contract it because of your immunocompromised status, and if you do contract it, you're more likely to experience severe symptoms. So it makes you more afraid of it, and it puts pressure on everybody's coworkers and families because they're under fear of bringing it home to you. Caregivers expressed this in the second survey. We surveyed caregivers as well. They're particularly worried about their loved ones or themselves contracting the virus or bringing it home to someone who's immunocompromised and has less resources physically to fight off the virus.
Yeah, and that was the next point I wanted to get to, and that's the fact that you also surveyed a group of providers and caregivers as well. Tell us about some of the other concerns you're also hearing from them at a time like this for cancer patients or cancer survivors that they're seeing.
Well, it's stressful to be a caregiver for a cancer patient in any circumstances. It's very complicated to balance sometimes the medications and the palliative care and the tests and the appointments. And then to have the added challenge of not being able to get in to see their doctors on a regular basis, or the challenge of communicating with healthcare providers. Many cancer patients have to go into infusion centers to receive their chemotherapy, so they're interacting with others at a time that they're fearful of being out in the public. One of the other things that we're asking Congress for is to pass an oral chemo parity bill so that people can get oral chemotherapy at home, if that's possible, according to their doctor, as opposed to having to go into an infusion center and interact with others in that public setting.
Can you talk a little bit about that method? What is that exactly for the folks that don't know?
So some cancer drugs can be either taken orally or injected. And in some parts of the country, insurance companies are allowed to only cover the injectable form, which is less expensive, rather than the oral form. But for some patients, an oral chemotherapy drug is going to be just as effective as the injected one. And they can take those drugs at home and not have to go into an infusion center and sit there for a few hours next to other patients who may or may not have been exposed to COVID-19 as well. So it's always preferable if it is in the patient's best interest to take a drug at home. But if it's more expensive for them, then that might be a barrier to them accessing that important safety measure.
No, I can tell you since all of this started, legislation was passed to even allow insurance companies to cover telehealth. Is your organization, or do you know of anything being done to seek lawmaker intervention in allowing cancer patients to take the drug orally at home?
In terms of taking the drug orally at home, yes.
Yeah.
I'm looking for the name of the act because I did have that.
But there is something being done.
The Cancer Drug Parity Act is something that we're asking to be included in the next stimulus package for the oral chemotherapy. I don't know if it addresses telemedicine. I don't know that we have that in one of our bills, but it's certainly been a godsend for many of the cancer patients to be able to reach their doctors virtually like we're talking right now.
But at least maybe maybe lawmakers can pass some sort of legislation, making it easier for them to get this, making it easier for insurance companies at least to cover this, because we've seen lots of things happen over the last 3 months. Perhaps this can be one of them as well. Tell me, how is your organization helping some of the folks here that you surveyed? How can you help someone who's concerned about the financial difficulties that they're having, about their access to speaking to a doctor? What should they know from an organization like yours?
They should contact our resource center at our 800 number, 1-800-227-2345. It's a 24/7, 365 day a year. When they're worried in the middle of the night about how to afford some of these things, that 800 number can connect them with resources that may be of assistance to them. Also at the COVID-19 information hub on our website, fightcancer.org, is another source of information for patients and caregivers to go to try to help them navigate this very challenging time for while they're in cancer treatment or having the after effects of cancer treatment during a global pandemic.
Let me ask you, when we know you did the first survey, and then you had the second one. You working with this organization, were these numbers surprising to you?
That's a tough question because we weren't really sure what to expect when it went out. As shocking as they are, I'm not sure that they were surprising in the first survey because we talk every day to people going through cancer treatment and we know the stress that they're under and the difficulties that they're facing. What was surprising to me was the dramatic increase in just 1 month's time. It seemed in most of our lives that first month of shelter in place was the most dramatic impact. We had to learn to do so many things differently. But to know that that impact isn't static for cancer patients and survivors, that it is continuing to grow in its intensity, that was surprising and troubling.
It is. They're really surprising statistics, and it really gives us an insight into really what is the big problem in our country, and it has been for years now. I mean, COVID-19 is just equally as bad because of the immediacy of what happens here. But this was a good reminder that we also have people battling cancer in various forms across the country, and it continues to be a problem. So a highlight needs to be focused on that. So Lori Bremner, Director of California Grassroots for the American Cancer Society Cancer Action Network, I thank you for joining us and providing this information. And we hope that perhaps Congress can act and really make some changes to help out this vulnerable group, especially at a time when we're dealing with COVID-19. So thank you so much for joining us today.
Thank you, Andre.